Afternoon. Welcome. You're listening live to Heart-to-Heart, a program which aims to help you understand and to become your loving self at KMET 1490 AM ABC News Radio Live. I'm Dr. Mitra Rashidian. I'm a licensed marriage and family therapist and a certified sexologist. And I'm here along with my business partner, a very good friend, colleague, mentor, you name it. I have a long list of how he's related to me, Dr. Robert Jaffe.
Thank you.
Please go ahead and
very sweet introduction.
You're welcome. You're welcome. Yeah, we have been working together and we have been through so much together for the past 17 years.
Yes, indeed.
And I have learned a lot from you. So you're my very good mentor as well as everything else.
Oh, that's very nice. Thank you.
You're welcome.
So.
And you are about yourself for our listeners.
Oh, about myself.
About yourself.
Oh, okay. All right. Yeah, I'm Dr. Robert Jaffe, licensed marriage and family therapist, and also a certified hypnotherapist. I've been working in this field since 1980. I've been licensed since 1984, and I love helping people at the depth to which we help people. It's really an honor and a privilege for people to let us in on their deeper on their deeper feelings and beliefs and conflicts.
Right.
And it's so rewarding to help somebody and see them overcome something that often has plagued them for most or all of their life.
Yes, that's true.
So I'm very blessed to be able to do this, and I'm blessed to have you in my life as a partner and as a dear friend.
Thank you.
And you are such a giving person. So
thank you.
I really, really love having you with me.
Thank you. We call that what? Ditto?
Ditto. Yeah. So. So one of my great interests and passions is helping people with addictions. I struggled with my own addiction. My sister struggled with her addiction. It got me involved in learning about addictions, and then I went to work for an addictions treatment center. I stayed there for 24 years and was like a mentor and also a student of learning about addictions and the family process and the way that people with addictions think and feel and believe.
Right.
And so that's what I'm here to try to impart some of that to the people who are listening to us today.
And the topic of discussion that you focus on, codependency, trauma, addictions, and how they impact our lives, it's such a deep factor and it's such an overlooked factor. In particular, the codependency part of it.
Mm-hmm.
That, excuse me, that, I'm glad that we have this opportunity to present that here so we can not only learn about it, identify with how we can be a codependent person, what kind of damages it brings to our lives, and how to overcome it.
Yes, absolutely. And so codependency, we've stated here many times, I'll say again, is the most overlooked and unreported addiction.
Right.
And that is so because it is not a chemical addiction. And it's also not an addiction that people have to do away with in order to have productive lives. They can still have productive lives. They can still have relationships. They can still have children. They can still have their work. They can still have fun. So then what's the problem with it, right? And the problem is that there is something missing for them. And sometimes they're aware of that. And sometimes it's just like a nagging feeling that something isn't right. And what that means is that there has been some emotional injury or injuries, often in their childhood, that are surfacing as feelings of I'm not complete. There's something about me that's deficient. I'm not enough. And those feelings of not being enough cause us to act and feel and behave in ways that create more problems rather than resolve those problems.
Exactly.
Yeah. So that's basically what I want to say as an introduction to codependency. And we say it's an addiction because the belief that we're not enough tries to get filled from things that are outside of us. And often people who struggle with codependency are also people who have other addictions. So other addictions can be chemical addictions, drugs, legal drugs, as well as illegal drugs, alcohol, and then other kinds of process addictions, such as gambling. And sex can be something that people do compulsively in order to change their feeling state, in order to get out of the emotional discord that they're in. And these addictions work to the extent that they make us feel better. And one of my clients, a songwriter, wrote a song called "Vacation Disassociation."
Yeah.
And she was really writing about how we don't actually even need an addiction. We can dissociate from the reality through daydreaming, or through television. As well as other things where we get this vacation from the oppression of the unmet emotional needs that we're carrying inside of us. So basically, what has to happen with codependency is people have to recognize that something is going wrong in their life and want to change what's going on from the inside out rather than from the outside in. And that's basically what healing is about. It's about understanding where your emotional pain originated, why it's still with you, and then what can be done to begin to release the conflict and the emotional pain that's inside of you. So there are a lot of behaviors that go along with addictions, and there's also behaviors that go along with codependency. But when you get through the behaviors, the negative behaviors, like the defensiveness that people have, the moving back and forth from being sweet and loving to being angry and cruel. But you go through back underneath some of those behaviors, or being overly compliant, or being overly controlling and domineering. When you start to lift up some of that, what you find then are what we would call the core issues.
So in other words, what I'm hearing is once we let go of our defenses, then we can understand why we are that way.
Very good way of putting it. Yeah.
Okay.
Yeah. We call them ego defenses.
Right.
And so the ego is that part of us which is concerned with physical survival. So when we are young, we know that we're little. We know that we can't take care of ourselves without our parents. I'm saying at the very beginning, 1, 2, 3, 5 years old, we know that we're incapable of that. We don't have the abilities. We don't have the knowledge on how to negotiate the world. And so as a result, we are totally dependent. And when we're dependent on other people are godlike to us. They have the power of life and death, which is a godlike power, and so the more that the people around us are unsafe, meaning that they don't exercise their power in a responsible way, they threaten us, they punish us, they hit us, they yell at us, they do negative things to us, uh, and and also they model what relationships are by modeling with their significant other, their spouse, um, not getting along, not being loving. These are things which affect us profoundly.
Right.
When we're very young, we take in all of our information through our right brain, which is our emotions, our feelings, and our right brain is always about survival. So the ego's job is to help us survive. So we learn how to survive through that mechanism of the ego figuring out what do I need to do to survive in this environment. And so as we grow older, we use those same ego defenses unless and until we recognize that it's also harming us to stay in those same defenses. What may have been necessary as young children are now not only not necessary, but actually helping helping us to stay out of our authentic true selves and out of loving relationships.
Right.
Yeah. So underneath all of this, all of these ego defenses are what we call core issues. And the book that I use, that I've recommended over and over again, is what I call like the Bible of codependence. The title of the book is called Codependence: Healing the Human Condition by Charles Whitfield. It's a book that was written in the 90s. Still very, very apropos. It's still in print. You can pick it up very inexpensively on Amazon. I don't get a commission for recommending it, but which I'd like. But anyway, in it, he talks about underneath all of these ego defenses are core issues. So there's a number of core issues. I'm going to state what they are first, and then we'll start to go over them one by one. We won't get through many of them today, but we will begin to get through them, and then we can pick up on our next program next week. So these are what he calls the core issues. One are issues of control.
Right.
Another are issues of trust. A third is being real. Being real meaning our authentic true self versus our adapted self, the self we needed to create in order to feel like we would be accepted in our family of origin.
So when you're referring to control, is that mean being control or being controlling?
Both.
Both,
absolutely. Right. Yeah, because it can be both sides of the same coin, right?
Right.
So all of these can be the doer and the doee.
Right.
You can take either side of it, and oftentimes people flip. The people who are very jealous in one relationship can find that their partner is very jealous in the next relationship.
Right.
Yeah. So control, trust, being real, feelings, low self-esteem, dependence, grieving our ungrieved issues, fear of abandonment. These are some of them. And we'll continue with this after our break. Please stay with us, and we would love to hear from you. You can feel free to call us during this hour or look us up on our page, KMET page, and we will talk to you very shortly after our commercial break.
Welcome back from our commercial break. Dr. Mitra and Dr. Robert here at Heart-to-Heart program at KMET 1490 AM ABC News Radio. For those of you who are just joining us, we are talking about the core issues of codependency, and Dr. Jaffe is going over all of them.
Yeah, so I went over them very quickly, and there's some more that I didn't go over, so I'll state them briefly here, and then we'll go through them a little more thoroughly. These are core issues. Once again, these are core issues that are internal conflicts that we have, and also internal pain that we carry. So they're conflicts and pain that we carry that motivate us to look for relief. relief from the conflict and relief from the pain. The relief that we seek is through our addictions, and the main addiction that we're talking about today is codependence. But this is true for all addictions. Underneath all addictions are these core issues. I'm not going to say this is ubiquitous throughout humanity. People do get into addictions on a physical level. For example, if they got into an accident and they got pain medication, they can get addicted that way. So that may be an exception to the rule. But for the majority of people who struggle with addictions, they struggle with one or more of these core issues. And these core issues can be resolved, and these core issues and once they're resolved, the person starts feeling better. It gets a relief from the pain, and then the codependency and or other addictions are unnecessary.
And like we said, that these core issues can appear consciously or subconsciously.
Correct. And most people are not consciously aware of the core issues. What they are aware of, for the most part, are the addictions. However, even with codependency, which is the most common and widespread addiction, people aren't even aware of that. So these core issues, again, I'm going to go over them. One is control, issues with trust, being real, which means being your authentic true self around other people versus attempting to fit in, right? When you're trying to fit in, you're blocking your authentic true beliefs and feelings for fear that the other person won't like you or that you will be rejected, or both. People who have low self-esteem. This is also a big thing. Low self-esteem usually manifests as I'm not good enough. People with low self-esteem often, well, I'm getting into it, but people with low self-esteem often have trouble taking compliments. Oh, that's a beautiful dress you're wearing. Oh, this old thing, I just threw it on. And they're saying it because basically they're saying, don't pay attention to me. I'm not really worth it.
Right.
Yeah. Dependency on other people, believing that you can't do it yourself. Grieving our ungrieved losses. So we've lost people in our lives, or we've lost beliefs that we've had. We've lost dreams that we've held on to. We thought our life was going to be a certain way, and it turned out differently. And so these are losses that need to be grieved, and then when we don't grieve them, they create that emotional pain for us. Bottom line for many people is a fear of abandonment. And I just want to comment on fear of abandonment. Abandonment is not the same as somebody leaving you.
Right.
Right. Abandonment is really something that can only occur if you are helpless. If you are helpless or believe that you're helpless. So let's say you're a woman and you have 5 children and you don't work, and your husband is the primary breadwinner. And one day your husband, he gets killed, or he leaves for another woman, or he doesn't come home, and you have no way to take care of yourself and your kids. That can be looked at as abandonment. Okay, even if it's through death, it's still an abandonment.
It is still,
right?
It is, yes.
Yeah.
The experience is that.
The experience is, oh my God, now what? Now I feel like I'm going to die. Right. So fear of abandonment. The next one is high tolerance for inappropriate behavior. Well, let's see. 4 issues. Yeah.
It's all or none thinking.
Yeah. So I'm thinking that these actually are all the core issues. I'm looking at the next page, but it doesn't really fit in with the core issues. So These are the basic control, the basic issues. The first one is control, so we'll talk about that for a couple of moments.
Right. Yeah, I like to. Oh, that's what I was going to propose. If we can talk about each one.
Well,
yes.
I accept your proposal.
Great. The healthiest one.
Do you have a ring for me?
I do have a ring. I don't know if it's going to fit you.
Okay. Okay. So, how much are we in control over in our life? How much control do we actually have, right? And the truth is that we do have some, and we don't have some.
Right. I was going to say it depends on from where we're looking at and what are some of the things that are in our control and what are some of the things that they are not. Nature is not in our control.
Nature is not in our control. And in the 12-step program, they talk about being admitting that we're powerless. What they mean by that is not that we're powerless to do anything. Obviously, we're not powerless to do anything. We do a lot of things, and I'm not powerless to buy this book or to read this book or to get on this radio program. I'm not powerless, right? But what they say is admitting that we're powerless. What they're really saying is we're powerless over people, places, and things. That's what they say in the program. So what does that mean? Well, the most important part of that is we're powerless over other people, right? Now, other people will argue that, and they'll say, "Well, no, I'm not powerless. I can tell my child what to do, and they do it, right? So I'm not powerless." Okay, so you do have a measure of control over your children, given that they are dependent on you. So your children, being dependent, are more powerless in the relationship, right? But the truth is that if your child really dug their heels in, you couldn't make them do anything.
Right.
You can sit there like some parents have done and say, you're going to sit at the table until you finish your dinner, right? And you cannot get up from the table. Well, the child can get up from the table. If the child gets up from the table, then you can threaten them. And you can say, well, if you get up from the table, you're going to lose television. Or if you get up from the table, I'm going to beat you. You can threaten the child. And therefore, you can control the child with threats. So are you powerless? Not technically. No, you're not powerless. However, what you can't control is how the child feels toward you at that moment, right?
And they're not disclosed.
And you can't force them to talk to you,
right,
or to tell you how they're feeling. So in some ways, we do have control over our children, especially when our children are little. And we need to have that control because our children aren't responsible enough to know what's dangerous and what isn't dangerous. We have to take control, right? What I'm talking about is control issues as adults.
Right.
Right. So if you are in a relationship with another person, that relationship may be in the form of a friendship. That relationship may be in the form of a coworker. That relationship may be in the form of an acquaintance. That relationship may be in the form of a lover, right? A spouse or a lover, a friend. These are all relationships that you do not have control over the other person. But when we are struggling with the issue of control, we may feel inside as though we need to have control over the other person, or we may go to the flip side where we feel as though we have no control over the other person. However, the other person has total control over us. These are relationship issues that we see in therapy.
Right.
Right? And where do they come from? Well, control issues stem from parents who had their own control issues. And so what they did was they took out their control issues on us. And their control issues may be that they felt as parents that they needed to be in total control of us, beyond the point where we needed to be controlled, or they felt like they had no control over us, and therefore they allowed us to kind of run free without feeling any sense of being controlled by our parents. Either way, the parent is going to 180 degrees toward control or 180 degrees toward lack of control, and it's damaging to the child.
Exactly.
Right.
Right.
And so maybe you can comment on how it's damaging to the child.
Well, let's look at the control. For example, the example that you used, when we tell the child to do your homework, or, you need to finish your dinner, otherwise you can't get up. That's a situation we can control as parents, as controlling parents.
We can.
So let's see what is missing in that. What is missing is the love, is the affection, is the compassion towards the child. We're not asking the child, what makes you not want to eat your dinner?
Right.
Maybe I can, help you with that. Maybe it doesn't taste good to the child. Maybe the child, is actually not feeling hungry. Maybe the child is having a stomach pain or feeling nauseated, or maybe, there could be many issues going on with the child that the child doesn't feel like having dinner.
Right.
Even if the dinner is his or her favorite food, right? So when we control and we give a threatening message like that to the child, we're creating fear, right? And fear paralyzes a child. Fear, tells a child that unless you cooperate, unless you say yes, you're going to be abandoned, and then there is nobody to take care of you.
Abandoned or punished.
Or abandoned or punished, yes, right?
Right.
And that's the core fear factor for a child, losing sense of safety, and then losing the sense of love and connection with parents, right? So even if we have a message to tell the child that the child needs to cooperate, if we take away the main component, which is, to me, affection, compassion, love and care and kindness from the child, nobody will listen to you, even a child of 5-year-old, even a child of a 3-year-old.
Actually, you're engendering the opposite.
I am.
No, you're engendering the opposite if you're being controlling.
Exactly. So, and then the child, at that time, let's see how this child becomes the controlling adult later on in his life or her life, right?
Yes.
So when we create fear, the child learns to be fearful, right? When we take the safety away, the child feels unsafe, right? When we take the affection away, the child feels that the world is a dangerous place, right? So what would the child do? I need to be controlling in order to survive. So here we go. We planned, and we initiate another controlling, environment for the child. The child learns how to be controlling, and then what would the child do? So in their next interaction with the parent, they use their controlling approach towards the parent who are controlling, and that's where the main clashes start to build up and to grow.
Right. So yeah, and it can go. We were talking about it going either one way or another. So if the child is being controlled, the child can then learn. I hate being controlled. I'll never let that happen to me again. And as a result, become controlling. Right.
Yes.
Or the child can say to themselves, this parent is telling me what to do. They must believe that I don't know what to do.
Yes.
And if I don't know what to do, that means that I'm not smart enough to figure it out. So I have to always find somebody who can tell me what to do.
Exactly. I have a couple that the wife is a very high professional functioning woman, and same thing with the husband. And the wife describes this way: my parents always did everything for me. I had everything ready for me. I didn't have to do anything in my life, right? And now that I'm married and have kids, my mom still tells me what to do, and she doesn't see me as a capable adult. And I ask her, how do you see yourself as a capable adult? She said she doesn't, because she grew up in a bubble, and now she feels handicapped.
Right.
Which is actually true.
Yes.
Yeah.
Yes. And so that's what we mean. If control is an issue, you can go on both sides of it.
Right.
You can become controlling, or you can look for someone who is controlling because inside you feel like you don't know enough, or
Right.
you're not capable enough.
Exactly.
Yeah. And so what does that what happens then in the relationship? If you are the controlling person, the person who's being controlled allows it, but underneath they have resentment.
Right.
Right? The resentment is, you don't you think you know what's best for me, and my problem is I allow you to control me. But there's a part of me that feels like you're not always doing it in my best interest. A lot of time you're doing it in your own best interest. So I feel like this is unfair. So I feel like the relationship is unfair, but I don't know how to get out of it because I feel like I don't know enough to be able to handle things on my own.
Right.
30 seconds.
Right.
30 seconds.
Or if you become the controlling person then says, you to the person being controlled, why do I always have to tell you what to do? Can't you figure things out on your own?
Right. Well, they can't.
And as though the controlled person is inadequate, which then pisses off the controlling person.
Right.
So we just got notified. We're going to have to take another short break. Please stay with us. We'll be back in a couple of moments, and hopefully you will find this of interest, and we would love to hear from you. So stay tuned.
Welcome back from our commercial break. Dr. Mitra and Dr. Robert here at Heart-to-Heart program at KMET 1490 AM ABC News Radio Live. We are talking about the core issues of codependency with Dr. Robert Jaffe. We would like to hear from you. Please call us at 951-922-3532, or you may contact us on our private information, which they can be found at KMET web page. So, Dr. Jaffe, we are at the core part of, controlling factor as a core part of codependency.
Yeah, so we just talked about control and how that's a core issue with codependency. And so people who have been controlled, or people who have not had their parents controlling enough, that means that the child walks around feeling unsafe because they don't have anyone looking out for them. And so then they figure they have to figure out everything all by themselves. And of course that interferes in their ability to have a close, loving relationship, because how do you share your inner self with someone when you've been forced to figure out everything on your own? And you haven't been able to confide in someone and to get someone to really understand you and to help you in the ways that you needed to be helped. So that's the first one. Moving to the second one, the core issue is trust.
Trust.
And all of these can be interrelated. They're all separate, and yet they're all part of the whole of core issues that can be addressed in therapy for people who struggle with addictions, and for people who struggle with the most common addiction, codependency. Often people aren't aware that they're codependent, but they are aware that the relationship isn't bringing them joy or the pleasure that they want to have. That brings them into therapy, and then the therapist, if the therapist is knowledgeable about addictions and about core issues, the therapist can educate them and help them understand what the issues are and help them begin to work on resolving them. So the second one is trust. And what does trust mean? Again, going back to childhood, childhood is a place where you have to trust. You are forced to trust because you are dependent. So the people around you, when you're 6 months old, when you're a year old, when you're 2 years old, 3, 4 years old, those are people that when you are that you know that you cannot live without them taking good care of you.
Right.
And so you learn early on whether they can take good care of you and whether they do take good care of you. Taking good care of you is both on the physical and the psychological levels, psychological/emotional levels.
Exactly.
So taking care of a child physically is obviously very, very important, and some children grow up without that. Some children grow up with parents who are addicts or alcoholics, who get drunk all the time, and the child at a very early age learns to go to the refrigerator and get milk and pour themselves some milk and have some cereal with it, and that's what they get for breakfast.
Right.
Right. And of course, so that's very damaging to the child, because the child then learns that they have to take care of themselves and often even take care of their parents, because the parent is drunk and the parent needs their assistance versus instead of vice versa. But going back to trust means that the child knows that they're going to be taken care of, at least on the physical level. And then if let's assume for the moment that that is accurate, and the child does get their diapers changed, and the child does get healthy food, and does get a safe place physically, then it goes to are the emotional needs of the child being seen, acknowledged, understood, and responded to.
Exactly. Yes. And we also have this stage of Erik Erikson, trust versus mistrust. So
Yeah.
that happens during around age 2.5.
Yes. Yes.
And that's where the child learns how to trust or not to trust.
Exactly.
Yeah.
Exactly. And so and so that's a very young age.
Yeah.
And many people don't remember what happened at that age.
No, but that's when we learn, am I safe or am I not safe? Can I trust or can I not trust?
And again, it's not it's not that black and white for the child.
Not, yes.
In that some needs may get met. Yes, I trust that I will be fed.
Right.
So I don't grow up with a need with the belief that I'm going to be hungry all the time. But I also don't. I also recognize that my parent doesn't understand emotionally what's going on inside of me.
Right.
And since I don't understand what emotionally is going on inside of me, then all of my emotional needs go unmet. And what are our emotional needs? What is an accurate? What do we need emotionally? One thing we need as children and as adults is to be mirrored. We consider mirroring like an essential emotional need. What does mirroring mean? Mirroring means that you are being understood as to what's going on inside of you. So I've used this example, I think, once before on this program. I'm going to use it again. And it's because my daughter is so good with her kids, and she has resolved with her husband to be parents who meet the child's emotional needs as much as humanly possible. Can't do it all the time, but you don't have to do it all the time. You have to be what we call the good enough parent. Good enough means you're doing it the major portion of the time. And one of those things is mirroring, which means that the parent lets the child know that they understand what's going on inside of them.
Right.
So I've used this example before, and I was observing it, that my daughter has two twin girls, and sometimes they will play nicely with each other. My daughter and my son-in-law, they buy them both the same toys so that they don't fight over the toys, but they still fight over the toys, and one will be playing with the toy. The second one sees the toy and wants it. And my daughter will say, well, you have this toy, it's the same thing, but it's not the same thing to the child. The child wants the toy that the other child is playing with. So occasionally that child will go over and pull the toy out of the other child's hands. The other child will then get angry and walk over and maybe push the first child. The first child will then cry and then maybe get up and swing and hit the second child, and it escalates. And so what my daughter has done, and I've observed this, is that she will say, wait a second, we got to have a timeout here, and I'm going to talk to both of you. My grandchildren's name are Sophie and Vivian. And so she will say to Sophie, so here's what happened, Sophie. You were playing with a toy, and Vivian wanted the toy. And Vivian, you came up and took Sophie's toy, the one that she was playing with, and you didn't use your words. You didn't say, I would like to play with your toy. Is it okay? You just took the toy. And then Sophie got her feelings hurt because you just took the toy from her. So Sophie then came up and pushed you. And you pushed Vivian, Sophie, because you didn't use your words and say, I don't like it that you took my toy, and can I have my toy back? And so then you guys started getting more physical, and it came out of the hurt feelings and the fact that you guys didn't use your words.
They used their behavior versus communicating.
Yeah, well, they did communicate through their behavior. Right.
Yes, right. Verbally, communication.
Right. Verbally. So my daughter saw their behavior as a request to learn how to deal with things differently, rather than rather than a bad behavior that needs to be punished. Right. So she explained it to them. Now, as she was explaining it to them, I was watching them, and they didn't seem involved in what she was saying, and I didn't know if they were listening or not. And so at the end, my daughter said to them, when you want a toy and the other and your sister is playing with it, you can use your words and ask her. And if your sister says no, then you can come to me and I will help you, because they're not really able at 3 really to work it out yet. So that's what she said. Now, after she was done, she looked at me and kind of smiled. And I said, yeah, 1 time down and 1,000 more to go. Yeah. Because yeah. They're not going to get it in 1 explanation or 2 explanations or 10 explanations. But as she explains it more and more, that will start to come back to them, and right. They will start to be able to utilize it.
So here's the thing, that I like to mention. So that is your daughter is such a capable and aware and, a trained mother, mm-hmm. and a professional herself. Mm-hmm. So it's easier for her perhaps, or she's more alert on what to say and what to do, right? Versus
she has the knowledge and the awareness.
And the awareness, right? And this is something that could be partly because of the professional training, but I think I see something much stronger there, mm-hmm. and that's the willingness to be educated on how to communicate with your child.
Right.
And that's the willingness that we would like to encourage among our listeners, mm-hmm. to be willing to educate yourself about child development, about child communication, about child training, so that when it comes to situation as minor as we see them, but for the child, that's their whole world.
Correct. Right? Correct. And so that's an excellent point, and I'm really glad that you said that.
Thank you.
The thing about that is that anyone can be a parent who's biologically capable of right. having sexual intercourse. Right. So you can have a 13-year-old be a parent. Right. You can have a 14-year-old, 17-year-old, 20-year-old. And the fact is that just because we are biologically able, it doesn't mean that we're prepared emotionally or psychologically right. for it.
Right.
However, the way that the law is designed is that anyone can have a child, and we also believe ourselves that if we have a child, we automatically should know what is good parenting.
Right.
Whereas the truth is that just because we can have a child doesn't mean that we know what is good parenting.
I think what happens when we have a child and we are not trained as a parent, we subconsciously look at our unmet needs and we believe that those are the child's needs.
Yes,
Yeah.
yes, exactly.
And we focus on those.
Exactly. So what we do then is we try to we believe that we know what's going on inside of the child
Right.
without recognizing that sometimes we may know and sometimes we may not know. But if we act as though we know and we're wrong, the child is going to go along with us because, especially when they're very young, because the child is a child. And so the child is always communicating through us, even at the very beginning. And what I say to new parents is that the reason that the child's eyes are about 3 to 5 inches away from the woman's breast is because when the child is drinking in the breast milk, the child is also able to see the mother's face.
Right.
Because the child can't see distances when they're born,
right.
but they can see up close.
Right.
And the reason that the child is looking at the mother's face is to see what kind of expression the mother is having.
Exactly.
And that's the beginning of communication. Right. You communicate through your expression and you communicate through your eyes, and the child sees the pleasure, or is supposed to see the pleasure of the mother, while the mother is either breastfeeding or even bottle feeding. As long as the mother is making contact with the baby is believing that they are being appreciated and nurtured and seen with love and care while their stomachs are getting full. So they then have that connection in their mind with my stomach being full and me taking in the positive love and connection that my mother is giving me.
And that's a perfect explanation of mirroring.
Yes.
Right.
Yes.
And I also would like to add that as part of that feeling safe is the way that our parents held the baby. So the touch is another form of feeling
Absolutely.
Safe and connected and trust.
Absolutely. So. Yeah, what I wanted to comment on is that I ran a center for parenting. It was called the Center for Professional Parenting. It may still be around, but it was like a 12-week course designed to teach people about the process of parenting from birth on.
Right.
And we had a hard time finding parents who were willing to put in that time, energy, and money to do it, because parents believe that once I'm a parent, I should know, or I do know. And the parents are very reluctant to see themselves as ignorant in that area.
Well, thank you for all that. And unfortunately, we ran out of time, and we would like to invite you to please join us next week, Thursday, at 3 o'clock for human sexuality, and at 4 about codependency, trauma, addictions impacting relationships with myself and with Dr. Robert Jaffe. And until next week, be safe, be well, and don't forget that all you need is love.
All you need is love.
Have a wonderful evening.
Okay, bye-bye.
Bye-bye.
The preceding was a paid program. Views and claims expressed are those of the program